I decided to initially purchase my iTero Element because I called my ceramist that I worked with for a number of years on my really complex cases, and I said, I want to switch to digital, I want to start implementing a scanner, what should I use? And it's what he recommended. So that's how I initially found the iTero. And what I love is that when you're working digital, and I was on the East Coast, my ceramist is on the West Coast, I can now take a quick scan, upload it, send it to my ceramist, pop out to call him, and we can have a conversation about what I need to do and what I need to change in the preparations when the patient's still in the chair. The iTero Element was a huge game changer in my restorative practice. Once we brought the iTero Element in, I switched from taking wet impressions for my single unit and multi-unit crown and bridge work to scanning, and it freed up time because I could scan or my assistant could scan, and my hygienists were trained to scan as well. And what we were able to do is that, whereas you can't take a wet impression until all of your preparations are completed, when you're taking a scan, you can scan everything except the teeth you're prepping whenever you have time to, whether that's the beginning of the appointment with the assistant because I'm in the other room finishing up my last patient's case, or whether it's at the end because that's when we do have the most time. It really gives you more flexibility than I ever had working with wet impressions. So as a fee-for-service practice, really trying to give patients the best care, the most time I could spend with them, the scanner absolutely did that and more for me.